What's up, sports rehab experts? Today we're going to be answering the common question that I get all the time is, do I have a tight psoas muscle? A lot of people feel that they have tension or a tight psoas muscle and they need to stretch it. They need to get it released. But is that actually the case? Today we're going to be spending time dispelling one of the biggest myths in the strength and conditioning and the rehab professional world is very rarely do you ever need to stretch a psoas muscle, or very rarely do you ever need to release a psoas muscle if that is even physiologically possible. Keep in mind there's a lot of structures you have to push through, meaning the guts, adipose tissue, intestines, to actually get to the psoas muscle, which is very, very deep here that attaches to the lumbar spine. So if you're putting some type of pressure there, you're also putting pressure through the adipose tissue, through the guts, and through the intestines. And sure, maybe you're getting some momentary release due to a neurological mechanism because of the pressure. Also, maybe you're influencing position of the innominate in the pelvis, which we'll talk about a little bit more. But likely that muscle does not need to go through the intense pressure or intense release that if anybody's digging your hands down into your low back to give you some type of temporary relief, you need to be thinking about trying to find someone who's actually going to solve your root problem as opposed to just address your symptoms all the time, which is the main source of problem. We're going to break this up into two parts, but the main source of problem is we cannot judge or cannot create a treatment plan of care recommendation based upon somebody's sensation, which is something that I see all the time for a myriad of different issues, variety of different body parts, is I feel tight in this area, so you just should go and stretch this area. Recently, there's been a new theme kind of coming about, is if you feel tight in a specific area, that's because the muscle is weak and the body's creating some type of neurological tension to try to help a weak area out. Okay, maybe that's a little bit plausible, but we're still missing the boat on one big factor, which is the factor that, again, we cannot judge the fact of if a muscle is feeling tight based solely upon the sensation. And we need to understand muscle function a little bit better. So there's two main types of contraction. There's three actually. There's an isometric contraction, there's a concentric contraction, and then there's an eccentric contraction. So if you're having a concentric contraction, that means the muscle is moving in towards each other and the bones are moving closer together. An eccentric contraction is the muscle spreading apart and the bone structure moving further apart, but ultimately this is still a contraction. It means you're still trying to create this inward contraction. The muscle can only contract in one way, which is this direction. So if you're actually lengthening the tissue, it's still contracting to try to prevent you from essentially ripping it apart, which is why there's tension created as you elongate the muscle. The best analogy I have for this is just think of a trampoline. If you're jumping on a trampoline and as you hit the bottom is going to spread and elongate, but it's still contracting in a way that's going to eventually push you vertical once it reaches an overcoming contractile point. So same thing with your muscles, is it will elongate until it either you return it back to a concentric contraction, or it develops enough tension to then elastically recoil, or it ruptures and it injures itself. So there's kind of just three different options. Contraction is always moving towards each other. When we have an isometric, nothing is moving, but a concentric, the bone structure is moving closer together. Eccentric, the bones are moving further apart, but the contraction is still in towards each other. And again, just think about that trampoline analogy, is as the trampoline spreads and it elongates, it's still contracting back to its original state. So as this relates to the psoas, we need to understand the psoas attaches to the lumbar spine and then down towards the femur. And one common presentation that you will see all the time is that the hips of the individual will be out in front of the body. What this does is it puts the psoas tendon and that muscle on an eccentric orientation, because now you've shifted your center of mass out in front of the line of gravity that runs through the body. So now, relatively speaking, because of the positions of your joints, that muscle is being placed on an eccentric orientation, which is exactly that trampoline analogy where you get that spreading effect to the muscle. That spreading effect to the muscle where it's still having the contraction in the opposite direction to prevent you from falling forward is going to create tension. That tension is not addressed by stretching an area. If you try to stretch that area, you're just going to push yourself further into that tendency and further perpetuate the problem. Sure, it might feel a little bit better because stretching kind of feels good to the muscle, but again, the purpose of this presentation and this video is to tell you you can't make decisions based upon sensation, which is why if you're getting some momentary relief from stretching, it's just that. It's for moments, and as soon as you stop stretching, it goes away. It's because you did not solve the root problem, which is the orientation of the joints, which is affecting the length-tension relationship of the muscle, and which is affecting how the muscle is functioning. It's functioning in an eccentric orientation, trying to hold your body up. It's trying to be the bottom of the trampoline to try to prevent you from falling forward. So we need to do things that gets your awareness to bring the pelvis in a better relationship underneath of the rib cage. The second part to this video, I'm not going to break it up anymore. I just made this decision on the go because I'm on a roll right now, is if you're in more of this forwardly orientated position. Now you're actually concentrically contracting. Now this is where the muscle is shortening because the two attachment points, the spine and the femur, are moving closer together. So in that instance, sure, stretching could be useful if we're not just thrusting the hips forward. We need to work on better reorienting the bone structures so that the pelvis remains stacked over top of the rib cage instead of in this forwardly oriented position where you notice this heavy arch in the low back. But an even better solution than stretching would be to use opposing muscles to create some type of contraction that brings the pelvis in the back in the upright position. So exercises that focus on the glutes, hamstring, and lower abs from a positional coordination standpoint, as opposed to necessarily always from a physical training, strength, and capacity standpoint, working on using the glutes and hamstrings, which attach on the backside here and help orient the innominate and pelvis in a more vertical orientation. Same thing with the lower abs here, helps lift up on the pelvis, lifts up on the pelvis to create a more vertical orientation so that it's stacked over top of your rib cage. That is going to be a better solution for you in the long term because you're teaching your body how to actively control the bone orientation, which is going to affect length tension relationships within your muscle. So first and foremost, if you're experiencing any type of tension in the psoas area, or if you're experiencing any type of hip or back pain, a lot of times people will blame the psoas. You need to be more focused on position of the body first, and what type of positions can you achieve and can you control, can you orient yourself in a position that keeps the rib cage stacked directly above the pelvis. Can you keep that and maintain that through a variety of different activities, or move in and out of that posture on demand and not have a tendency to be in one of these forwardly orientated positions here? That's going to do you a lot more better, proper English there, to overcome this tension that you're feeling in the psoas region. So number one strategy to reduce tension in your psoas is not stretching, it's not strengthening, it's focusing on position first. Then you can get into some type of strengthening so long as you're still being mindful of position of bone structure and joint orientation. And then thirdly, only stretch if there's a concentric orientation, but better yet, again, would be using active solutions to reorient the pelvis and the rib cage in a more stacked orientation. So if you're dealing with these sorts of issues, if you're an active individual or an athlete who's trying to overcome some type of hip pain, back pain, or psoas tension and are wanting some type of help, we at Sports Rehab Expert help give out both a standardized program as well as individualized programs to individuals. If you're looking for either one of those and some coaching, email me at greg@sportsrehabexpert.com and I'll be more than happy to provide you with that type of information. If you're a rehab clinician looking for assessments and exercises, treatment interventions, and plan of care's strategies that actually have a step-by-step process with logical reasoning behind the biomechanics, the anatomy, the physiology, as well as a research-based approach, then head on over to sportsrehabexpert.com, check out our fast track course, or jump into the Sports Rehab Expert certification process, which is a combination of 2 courses, the Treatment Domination and Human Assessment Mastery. Both of these courses make up the Sports Rehab Expert certification, or you can just get started on the Sports Rehab Expert Fast Track, which is essentially just a jolt of information provided at your fingertips just to start dipping your toes into the concepts here of what ultimately will take your clinical skills to the next level. So thanks again for tuning in today's video. We'll be back at it soon. Talk with you next time.